The day 10-year-old Sarah Murnahan's parents fought so hard for finally has arrived. Sarah is in surgery right now, getting a lung transplant. We've been following the story so closely, so much attention on her. But again, the parents, we've talked to them. They say this is not just about her. This is about so many kids on lists like these under the age of 12. Her story is this. She has cystic fibrosis. But until a judge intervened very recently, Sarah couldn't qualify for lungs because she was younger than 12. You have to be over the age of 12 to get adult lungs. Well, today, she's getting those lungs that she so desperately needs. The donor is an adult. Her mother, Sarah's mother, announced the news on Sarah's Facebook page today. Here's what she wrote. Let me read it for you. Quote, Sarah got the call. She will be taken back to the OR in 30 minutes. Please pray for Sarah's donor, our hero, who has given her the gift of life. Dr. David Weil is the medical director of the lung and heart-lung transplant at Stanford University in California. Dr. Weil, welcome. Start with she's getting adult lungs. She's just a 10-year-old. How do they cut the adult lungs in order to fit inside of her?
You can do either that, or there's certainly some children that are big enough to accommodate an adult-sized lung. So you can actually do it either way.
Is it a fairly simple process?
It sounds complicated, but it is a simple process. The best case scenario is to find an adult lung that actually will fit inside a child's chest cavity because it's simpler. But if you're unable to do that, you can certainly cut a lung down to accommodate a child-sized chest.
It's incredible with transplants what can be done. And so once they get the lungs, it's a pair of lungs inside of her, when will the doctor know that she's able to breathe with these lungs, that she's beginning the steps to be in the clear?
The first 24 hours is certainly the most precarious in terms of the post-operative recovery. And I think it's safe to say that everybody will be holding their breath, no pun intended. Mm-hmm. I think that the first week is particularly difficult for some patients, particularly ones that are as sick as Sarah has become over the last several weeks. So we should expect some complications after surgery naturally, but we sure hope and pray that she does well.
So, of course we do. And so it's really the precarious 24 hours and then really the week. What are the chances she could reject the lungs?
I think rejection always is a possibility, although it doesn't really happen as much in the early postoperative period as one would think. The early postoperative period complications are more typically those related directly to the surgery. In other words, bleeding complications or problems getting the transplanted lungs to work properly. Rejection is something that generally happens further on down the road.
And this is life or death for this family. We've been in touch with them. Sarah's sort of aware of it seems like her mortality at the age of 10. What do you, doctor, if you're walking out of this surgery, what do you tell the parents?
I think just very similar to what I just told you. I think that I would expect some complications to happen and for the recovery not to go just in a straight line. There should be an expectation that the first day and the first week will be difficult, but that this has given her the best opportunity for a full recovery, and we should all be thankful for that, and I'm sure her parents are.
Yeah, Dr. David Weil, thank you so much for your perspective, and we're just thinking of Sarah and any little one in situations such as hers. Doctor, thank you.